had some time today, so decided to sort out one or two questions I've been getting over time. That's what we're doing at this point in time. We're just looking at a few questions. A very straightforward process. Just answer some questions that people have. That is all it is. So there's no announcement, nothing. We just do it. I have time. We'll do it. I don't. We do it. Okay, so we just have a bit of time today. And the thought process is that how do you actually get your IVF success? How do you get your IVF results? What can you actually do if you want to get pregnant? That is what the goal is. And I'm discussing this because of the fact that um, for the center I worry, there's a patient that came in from Germany, had some issues, so she came around and wanted to see if we could help her get pregnant. She did a procedure, went back, delivered her babies in Germany, and sent the images back to worry. And I just posted it a short while ago, and I thought to myself, like, what practical step can you really give to someone that is trying to get pregnant right now today? That they can take and say, if I follow step one, step two, step three, step four, step five like this, and I get to the end point, I will get pregnant. I'll get pregnant. So I looked at this now, and that is just what we are discussing. That is what we are discussing. So this is how it goes. If you are currently in this particular moment trying to get pregnant and you don't know where to start from, this is for you. You are the exact person that this conversation is for. And the reason why it's for you is because if you follow these steps, by the time you get to the end, if you keep on moving with it, there's a very high chance that you get your pregnancy, you get your baby, and you can actually move on from there. So step one, which is what I believe that if you are really trying to get pregnant, you should have done at this point. But if not, there's no problem. We're trying to get you through the processes that you need. So step one is that if you're trying to get pregnant, you must go to the hospital for your consultation. You must visit and see your doctor. That is step one. Go for a consultation. When you get there, what we are trying to start with is what is the source of this problem? And that is a very, very important question. Meaning that when we get the answer to this question, what is the source of the problem? Then we can start knowing what to do. Because there are many people that are not pregnant, it is true. We know. But everybody does not have the same issue. Everybody does not. For Mr. A, what may be causing, okay, so if let's use practical examples. A few days ago, now this is just a few days ago here, a lady came to me, she wanted to get a review and all that. I said, okay, no problem. What do you want to review for? She said, oh, she wanted to know if the fibroids we have will affect her getting pregnant. I said, okay, have you been told that you had fibroids before? She said, yes. And when it was a couple of years, whenever I see that kind of thing, I know that there's a problem. The doctor might have said, oh, ma, we want you to actually remove these fibroids. So, and maybe they say they don't want to, something like that. That's what usually comes in situations like this. So what I did was I said, okay, let me see the scan. And in conversations, she and I realized that she had some other products that she was told that if she takes them, uh, the fibroids are going to shrink and she cannot get pregnant. Now, I'm not making any comment about that. What we're discussing now is what I saw on the scan. So for her, usually you see your scan report now. Some of you might have done scan, which is something you're going to when you are doing your if you are doing your review. So for her, what happened was I saw the uterus was bulky, which means that the size of the uterus is no longer just what it's supposed to be. It's now bigger and thicker. Where the fibroids were, the uterus has a tube-like place where babies are supposed to be growing in. Where the fibroids were, they are compressing what we call the endometrium. They are compressing that particular area. What that now means is that it's difficult for her to get pregnant because where the baby is supposed to follow is now blocked. For that kind of person, our first step will be to take out those fibroids. Some other persons will come in, and when they come in now, we now find out that, oh, what is actually happening is that for them, their sperm is low. And because the sperm is low now, we now say, okay, be on some drugs for a couple of months first. After you've been on the drugs for a couple of months, then let's review and see if it's actually possible for you to use your semen like that for the IVF procedure. That is for the person that is issue is sperm. For some other people, they come in and you find out that what happens is that the tubes are blocked. We now start discussing options. Okay, for this kind of patient, will they benefit from hydrotubation? For this kind of patient, do we simply, because we don't need the tubes for IVF, do we forget anything about patency of tubes and go straight for anything about patency of tubes and go straight to how we can actually deal with the fertility issue? Age is a different factor. Somebody comes in and they have been trying for 5 years, but they were trying from 21, they are not 27, or maybe they are not 26. It's different from somebody that comes in at the age of 35. That's okay. No, let me use it at the age of 45 that has been trying since when they were 40. Different options. You understand? Different options. So that is why you cannot say you're trying to get pregnant and you have been trying to conceive and you've not been to the hospital before. Because if we don't find the issue, we cannot know how to help you. And now there's a subset of people that will now say, oh, but doctor, I've been to the hospital. I got there and they told me they don't know what is wrong with me. They can they cannot even identify what the problem is. How can they not help me? I speak to you and tell you the truth that it is true that there are people that when they come to the hospital, we check them, we don't find what the issue is. It's not village people, it's not witchcraft. It's not that okay, maybe we can say it's the level that medicine is currently. Maybe that is what we can shock it up to. But there are some people that we don't. And we call that unexplained infertility. It is not a surprise. In fact, a number of people, some studies will tell you that once there are infertility issues, 30% of them is issues coming from the male, 30% from the female, 10%, 40% from a mixed factor. You can identify some. It's just what it is. It's just what it is. So what I'm telling you about this is that essentially, when we find issues, we can know what to do. If we don't find an issue, we still know that we have to go to the next option. But let's start from there. If you've not started looking for issues, you've not started. So if you are watching this now, you've never been to the hospital, and you say you are trying to get pregnant, I am here to tell you that. I'm here to tell you that you have not started trying to find a solution to your fertility problem. Then we're not going now. When you come in, we do tests. That is step number 2. You come to the hospital, we're trying to look for the problem. We have to do tests to find out what the problem is. We have to start checking. We check hormonal factors. We check the tube of the woman. We check sperm. We check the man's private part if the testis has an issue. We check the woman to see is there anything obstructing the cervix. We check oral. We're trying to do a total review to try and identify any factor. Some people, they don't need IVF. They don't need IUI. They don't need anything special. What they just need is drugs. They will get pregnant. And there are couples like that. They have had a couple come in and say, oh, they want IVF. They are ready for IVF now. We did a screening. We saw that these people, they don't need IVF. What they need is that they are having hyprolactin. Place them on drugs. For some of them, within 3 months, they carry their pregnancy and they are gone. They don't need to do any IVF. That's some people's situation. Another person comes in and they have been trying to get pregnant. Oh, she has been trying. But the husband is barely around during the ovulation period. So the trying that she has been trying for the last 1 to 2 years is empty because they've been meeting at the wrong time entirely. That one did not need any special procedure, did not require prayer. Educated her about her ovulation period, educated her about her fertile window, how to calculate it, and from there she moved on to getting her pregnancy. So what I'm telling you is that there are different categories, different things, and when all of this is going on, you don't listen to somebody else's somebody else's story. It's not somebody else that is going to give you it's not somebody else that is going to tell you how they are going to do it, how your own is going to be. You heard that they did so for so and so person, and so you now want to follow that one. It's a different thing. It's a very different thing for everybody. So find your problem and then know how to go from there. When you finish doing your test, this is now step number 3. When you finish doing your test, you come back again to review those results. I'm breaking it down. If you can break this into just like 4 or 5 steps and it's done. But I'm breaking it down like this so that if you are looking at this, you can from here like this, you can identify step 1 for you to do, step 2, step 3, step 4. Follow the step like that to the ending. And when we get to the ending, there will be some people that maybe they get to the end, they don't get pregnant early. I'll tell you what to do. That if you keep on following, you will get pregnant, you get your baby. You get your baby. So this is now the other point now. Yeah, so like I was saying, you now get to that point of review. After you've done your review now, we have seen what the issue is now. They will now decide what should we do for this person. There's no rule that is like this for everybody that has having an issue. This person having some people say, my sister will be having difficulty getting pregnant. What can she do? How do we know what she can do when we don't know what her problem is? It starts from knowing the problem now. When we know the problem, we can identify the next step. Based on the issue, the test review that has come, we'll now say, okay, this person, based on what this test is saying, this person can do an IUI, intrauterine insemination, collect the sperm from the husband, process it through the lab, put it back into the woman. Let's do this. She may get pregnant. IUI is something on that conversation from another day. But IUI is something that oftentimes requires repetition to get the solution. It's more affordable than an IVF. So that's why most people will go for it first. And it's usually recommended for women in their younger ages, optimally below the age of 30. Most people will say maximally below the age of 35. That is what you use for an IUI. They will not go, so you see, that is that one. But a woman that is at the age of 42, that comes in and says she has been trying to get pregnant for some time now, she's not getting pregnant. What can she do? I'm not saying IUI. We will not say for this person IVF. Some people, even within that same IVF that we are doing, somebody will not say, oh, my semen is not too good though. I've been on drugs for some time, it's not coming up. What can I do? They will not tell you that what you should do is an ICSI. ICSI, intracytoplasmic sperm injection. What it means is that we collect the sperm from that man, and instead of just allowing natural fertilization to occur in the lab, we use special tools to select healthy sperm and inject it directly into the air because that man's sperm is not strong enough directly and do the work of insemination. So I don't getting the different ways, different possibilities that are actually existing for somebody that is actually trying to get pregnant. You are seeing the different ways that different people can have different solutions to the same problem. Okay, for some people now, we finish checking this thing. We see that okay, this man's sperm, there's no way, no go. There's no obstruction, there's no hormonal issue that we can identify. Medications are not working. This person cannot use this sperm. That's why we now start talking about donor eggs and donor sperm. A woman is at an age. Yes, I saw a recent publication. A woman that was about 50 years used her egg for her own IVF and it was successful. Good and fine, it happens like that. But the subset of people that can get that are small. So except you are willing to take the risk that okay, let me try. I know that the chances of success are less than 5% for this my thing I want to do now. So, and I know that the chances of getting a baby that may have a genetic defect are increased. You can actually decide to circumvent that by doing PGT. Or that PGT, sure, pre-genetic testing to make it simple. You can do pre-genetic testing to now see if there's any issue. So, but that cost now, we're looking at to do that now that you want to use your eggs and do genetic testing, you are looking at about 10 million naira plus to do that one. Trying to make that there are different options for different people that have fertility problem. The way you now go beyond that one now, identifying which way. What am I identifying this way now? I'm starting from let me make it so that you can get the totality of it. Number one, the first one is that some people is just counseling they need education to meet. This is usually for younger couples. Let them know how to calculate their ovulation period. That is not middle, it's not just 14 days after their period. It's 14 days before the next period. And there's an ovulation window. It must not be on that 14th day. You can use an ovulation tracker. You can use an app. You can use a home ovulation test kits to test to know when you're in ovulation. Or you can just estimate the week. Okay, I have my period comes out every 30 days. So if I minus 14 days, that means 16 days before the next period is my proposed ovulation day. And that period too, okay, meet you may not be able to get the exact day, but you can meet, okay, 4 days before, within 3 days before, 3 days after. So within that week that you know there's ovulation week, you meet your husband regularly during that period, you're likely to get pregnant. That's what's the problem for some people. Some people, it's not that one. So okay, let's see ovulating, because some people it's not just you can, okay, I had somebody send me a video. She told me that she sees that sticky fluid that they call ovulation secretion just when she's having her menses. Is it possible that she's ovulating with the menses? I feel it's highly unlikely. It's highly unlikely for that to be happening. What is likely is that you are ovulating at the time and not seeing the cervical changes, the mucus changes. It doesn't mean you are not ovulating. If you want to know, do follicular tracking. Go to the hospital, go to any good radiological center, sonographical center, tell them you want to do follicular tracking. Tell them you want to do follicular tracking. When you tell them that you want to do follicular tracking, they will monitor you from when your last period ended, be tracking you. They will see how many follicles you have. Then they will see at the time when we expect that the follicles will be expelled. We will not see that, oh, they are ruptured, they have expelled. We will not say, okay, this is what it is. Asking that has given birth to her child now, it's follicular tracking she did. It was not drugs. She went, did the scan, saw the time, so that you have very good 4 follicles that are developing here. Oh yeah, it's getting to the time of your ovulation. Go and meet your husband. Met and they delivered the baby. They have done naming ceremony. The baby is with them. That's another option. If you not take that one out, you can ask, okay, some will require drug. Right, some people looking for letrozole, they've taken it and they abused it in a way that is not so. No, there are ways and logics behind the use of these things. You place them on the drugs and they move. They take the drugs, we tell them when to take it, we track them, we tell them when to meet with their husband, so they get pregnant from there. These are options that exist of IVF. All these options, they exist before you start thinking of IVF. Before you now look at IUI. In that drug option, there's for those hormonal discrepancies, male sperm factors, all of those things, PCOS, even diabetes and all those ones. There are other drug options. After taking that particular one, now the next thing now is now the IUI that everybody likes, and the IVF that is now there. So you see that is what we mean by deciding what to do. That what we mean by deciding what to do. I don't want to spend too much time on this video, so because I was just relaxing, and I just saw the images of the woman that gave birth to the twins in Germany, and I thought to myself that let me just explain something to some people today. So that is it. The next thing, step 5, is monitoring. When we've decided that, so this is what we want to do, and we start that process, we start to monitor you and watch you. You are told to take some, okay, for IVF now, most of the process is about 6 to 8 weeks. You take some medications for about 3 weeks usually, depending on the way your clinic is navigating. Even if let's even go down to basic, we're using follicular tracking. You come in, we tell you to come on the first day, as your period, the first day of your period. From there, we know we can start. Let's say we start from there, because that's the end of a particular cycle and the beginning of another one. We tell you to come on day 2, we can say day 10, because day 5, we're tracking your follicles. This is monitoring, which still happens even within IVF, which still happens even within IUI. We are monitoring you. So for patients that are far from us, what we will do in that case is that they do these scans and send the result from where they are. We have to follow up. We are monitoring because there are indications that we are looking for to ascertain whether our procedure is getting response, to ascertain whether this route we are following is going to give us results, to ascertain whether this particular patient can benefit from this particular strategy. Because remember, your doctors are not gods. They are not soothsayers. We are taking feedback. What we are doing, this is what we think it is. We do this one. We observe. Okay, it's going well. Then we'll continue with that monitoring. Then it depends on what we're not doing next. If it's ovulation induction, you take your medication and you go and meet your husband. If it's IVF, for example, we say, okay, come, we want to collect the egg now because the egg has come to a point where it has developed very well. We've given you medications to stimulate egg development. Your whole cells have developed. Then we say, okay, come on a certain day. We give you medications to trigger ovulation. Usually, depending on the nature of the period, 24 to 36 hours. 36-hour mark, we collect the eggs from you to take to the lab to go and start incubating, which is the next step. When you now finish incubation now, we allow the baby embryo to grow for about 3 to 5 days usually. Select the best ones from there, take it back and put it into your womb. Then we now wait for 2 weeks. 10 days. From 10 days, we can start seeing if you are pregnant with a pregnancy, but usually they wait for 2 weeks, do a pregnancy test, and from there you go into your antenatal. When you follow these steps, that you've come, you've done your consultation, you've done your testing, you've had the results be reviewed, a method has been chosen for you to do your IVF, for you to battle your infertility, to deal with the source of your infertility. We follow that method. If that method does not work, the next step is to now either we are retrying depending on what we are doing, or we are considering other options. Because fertility options range from just counseling to surrogacy to adoption. The truth about the fertility journey is that sometimes getting pregnant comes at the cost of something you don't want to do. Because some people don't want to hear that somebody should carry their pregnancy, and I understand it. But sometimes that's the option that works. And we advise you to do the option that works. We will not say, oh, just don't worry, anyhow. We look at it. If this one is going to work for you, that's what we advise you to do. The women have come out to do IVF. We say, no, you can't do IVF for you at this point. With this issue, too, is surrogacy. If somebody is carrying this pregnancy, if you try to carry this pregnancy, you spend money and you not get the pregnancy. And you may see a woman that doesn't see IVF, no success. At some point, somebody may have advised her that stop IVF, do surrogacy. You have to also understand what is the source of the problem. What is the source of the problem? There's a condition we call adenomyosis that can make it quite difficult to get pregnant. Some people advise you to do a surrogacy. But work with your doctor closely. Your doctor's best interest is in your success, because it's your success that proves the competency of their program. It's not you paying money to them. It's the success that you got pregnant, you carried that baby and delivered. That makes it so sure that this person knows what they are doing. So that is what they want to. That's what they want to. So these are just steps that when you follow, you get to the end point, you've done your procedure, you don't get pregnant. Don't give up. Somebody give up and that's the problem. By the time you end, see, IVF and your fertility options, one good thing about them is that they have given us room to get pregnancy where before you just forget about it. That's one good thing about them. They've given us that chance. And because they're giving us that chance now, it seems as though once it does not work, that is again. No. If it does not work once, you try again. If it comes to a point whereby that's why it's best to start early. If you are hearing this today and you have not done yours, start early. Money is a problem, it's not a lie. These procedures are not 500 naira. They're not $1. They're expensive. But the earlier you start and just zero your mind that you're not going to give up until you get what you want. And if the particular method that you wanted to use is not giving you what you want, consider another option. I'll keep going. Worst case scenario, it ends as a surrogacy. Somebody else carries the baby for you. Painfully, it may be that you have to consider a donor egg and a donor sperm option for that surrogacy. Or it may be that you say you don't want to do surrogacy, you want to do an adoption, but you can get a baby too nowadays. If you stay on task for some time, you can get a baby. Even if you are 55 today now, they say, oh, you cannot do IVF again or 60. You can decide that, okay, what you want to gather your money for is for surrogates. They will donate the egg and sperm. Yes, the argument now comes in that, oh, if the argument now comes in that, oh, if somebody else carries the baby and the person donates the egg and the sperm, am I the mother? Am I the father? I see. Everybody has their viewpoint on that matter. But me, I think that women that are going through trying to conceive issues, that have spent strength and effort and resources in trying to get their babies, when they get their babies, they will understand more about motherhood than women that just got their babies anyhow. Because they know the stress it has taken. They know the amount of effort and struggle it has taken to get there. You know what it is to yearn from your heart for a baby to call you mommy and not get it. Those are mothers. Biologically, different origin. But it does not mean that the mother is not the mother. Let's end this here. Have a wonderful day.